Hi, welcome to this video. My name is Philippe Voyer. In this presentation, I'll show you the results about the validation of radar for detecting the sixth vital sign. If you don't know about radar, I suggest you watch the other videos where I present in details how it works. But here's a very quick overview. It's based on the interaction that you have with your patient. So when you give your patient the medication, you ask yourself three questions. Was the patient drowsy? Did the patient have trouble following your instructions? And were the patient's movements slowed down? And you answer yes or no. And if you say yes, this item is considered positive, and then it is a positive radar, suggesting that you have detected signs of delirium. As mentioned in the title of this video, I want to show you the results of the validation of radar as a measure of the sixth vital sign. So what is the sixth vital sign? Is when a patient presents both inattention and an altered level of consciousness. So the goal here is really to look at if radar can detect a sixth vital sign. And if the sixth vital sign is present, then you move to the next step to detect if the patient has delirium. You can use the 480, and then if the 480 is positive, you advise the physician. I'm going to start by showing you the results of this study just published in the Canadian Journal of Emergency Nursing. As mentioned, this study was conducted in the emergency room. The lead researcher was Marcel Lemont. 57 patients took part in this study. They were all older patients. 0 patients with cognitive impairment. 256 radar were administered in this study, an average of 4.5 per patient. The radar were administered by student nurses, and 7 patients had at least one positive radar. Sensitivity of radar as a measure of the sixth vital sign was 100%, and specificity was 89%. As mentioned, 7 patients had positive radar. When we look at them more closely, all of them showed an altered cognitive status. 1 had a sixth vital sign, 3 had a CAM positive, and 3 were meeting the criteria for a subsyndromal delirium. So all of them had something going on. Interrogator reliability in this study, the percentage of agreement between among student nurses, 89%, and the kappa value was 0.46. The second study was conducted in a nursing home. It was done by Isabelle Pelletier, a master's degree student. 45 residents were included in this study. 42 residents with cognitive impairment or dementia. Radar was administered for 7 consecutive days by licensed practical nurses, and 14 residents had at least one positive radar. Sensitivity in this study was 86% and specificity was 79%. 14 residents had at least one positive radar. All 14 residents showed an altered cognitive status. 2 met criteria for DSM-5 delirium, 5 probable CAM, and 7 subsyndromal delirium. Interrogator reliability was very good. Percentage of agreement among ARA and LPN ranged from 94 to 97%, depending on the question. Kappa value ranged from 0.4 to 0.7, depending on the question as well. Another study conducted by a master's degree student, Catherine Bilodeau, was conducted. This study was conducted in residential care. 31 residents were included in this study. All of them were older adults and also have cognitive impairment. Radar was administered for 7 consecutive days by 8 nurses, and 8 residents had at least one positive radar. Sensitivity for 6 vital signs in this study was 67%, and specificity was 79%. 8 residents had at least one positive radar. 7 out of 8 residents showed an altered cognitive status. 1 met criteria for DSM-5 delirium, 3 probable CAM, and 3 subsyndromal delirium. Interrogator reliability was very good, and I want to stress the fact that this comparison was made among research assistants and aide nurses, so this was a first. So the percentage of agreement among RA and aide nurses in this study range from 94 to 99% depending on the question, and kappa value range from 0.76 to 1 depending on the question as well. Before we finish this video, I'd like to share with you some of the latest results about radar in other countries. Radar was validated in 2 post-acute care settings in the US by Kana Lewallen. She tested the inter-rater reliability of radar, and the kappa value was 0.63. She tested as well nursing staff acceptability of using radar, because she implemented radar for all residents of both long-term care facilities. And 80% said that completing radar did not result in significant increase in their workload, and 91% said it was easy to insert radar. Radar was also validated in a rehabilitation ward in the Netherlands. The first part of their study was to translate and validate radar in Dutch. So they did a pilot study. They administered radar 224 times, and they were able to test inter-rater reliability among nurses and research assistants, and the kappa was 0.81. 90% said that completing radar did not result in a significant increase in their workload, and 100% said that it was easy to insert radar. They did some more analysis of the data, looking at the detection of delirium with radar, and the sensitivity was 100% and specificity was 77%. These results will be published in Age and Aging. Finally, radar has also been translated in German and also in Italian, and they have been validated and used in research. If you want to know more about these versions, I suggest you contact these persons that you can see on the slide. In conclusion, radar has been validated to detect a 6 vital sign, and among all participants with a positive radar, 89 to 100% of them had at least one symptom of delirium. Inter-rater reliability was good to excellent in the studies that I presented, and radar was very well accepted among staff. If you want to know more about radar, I suggest you visit its website. Thank you very much for your attention.